to this week's wrap-up session of 3 healthcare headlines you need to know from Tallahassee for this 2024 legislative session. We're pleased to be with you again today to give you an idea of what happened at the end of legislative session. So my name is Fraser Cobbe. I'm pleased to be here with you again this week, and want to introduce my partner here, Joe. Want to introduce
Once
yourself?
again, yeah, thank you, Fraser. I'm Joe Daraskevich, and just like Fraser, I work with several societies across the state of Florida. And bittersweet, this is the wrap-up edition. We've been meeting with everyone every week here, and we'll have a little bit of a recap on everything. But don't worry, we'll still be around giving you updates on things throughout the year. So, Fraser, we'll get started. Top 3 headlines here today: with opportunities for expanded access to care, Florida's patients are big winners this legislative session. Why are they winners this year?
Yeah, and I think this summarizes a number of the issues that we've been following throughout session, Joe. It started with the Live Healthy legislation. It passed early in session, or at least got significant momentum going and across the line. And actually, that Live Healthy movement, it would have to be called, and contains several different bills that move through the process. So in the end, that entire package has been passed and sent to the governor for his signature. But there's a number of issues that are built in there that should expand access to care for Floridians moving forward. The overarching goal, of course, was to address our workforce issues with an expanding population, making sure that we have sufficient clinicians are able to continue to render care and meet the challenges of this growing population. So from loan forgiveness to residency program expansions to licensure opportunities to streamline that process. I mean, all of it should hopefully, if successful, result in increased access to care for patients, in the state. In addition to that Live Healthy effort, the workers' comp legislation was passed unanimously in both chambers in the end, and that has also been sent to the governor. And the underlying premise there was that Florida had the worst physician participation in the nation. And by looking at the fee schedule primarily for physicians, could we incentivize more doctors to come into the comp system to treat injured workers? And that should also open more doors for injured workers to get timely care and hopefully return to function as soon as possible. And then there was a number of other specific bills related to cancer that passed that should expand access to testing and treatment. You had breast and cervical cancer incentives to make sure that there's coverage for screening, early screening to prevent breast and cervical cancer, skin cancer coverage requirements as well for the state health plan and Medicaid beneficiaries, and then the cancer biomarkers, which we've talked about quite a bit as we go along. So I think kind of packaging all those together, it should be a net positive in the end run for patients as far as their ability to access the world-class healthcare we have here in the state of Florida.
Well, yeah, Live Healthy is one of those things that we've been talking about. We started talking about it week 1, and we kind of give updates throughout the session. So it's exciting to see all those little details come to life, and then see what happened in the end game here. So that was a pretty exciting topic to cover throughout the session, week in, week out.
Yeah,
Topic number. Go
and Joe,
ahead. Yeah.
before you get started on the second one caveat we should mention is, of course, all these bills have to be positioned and sent to the governor's office. So our next bit of focus will be making sure that we answer any questions the governor's office may have on the virtues of all of these bills that have been passed, and hopefully he does sign those into law, so we can truly reap the benefits for patients here in the state on all those bits of good legislation.
That's a great point. Yeah, one more big moment for all of these pieces of legislation. They've got to get across that desk. All right, moving on to the second topic this week: more menus and pricing coming to hospitals near you. What do you mean by that?
Yes, so healthcare transparency has been a topic that's been addressed at a federal and state level for a number of years, but we've never really been able to move the needle much on providing patients with actionable information for them to make smart decisions as they're pursuing, treatment that they need for themselves or their family. Speaker Renner had this as a priority coming into session, and this bill kind of emerged. I know it was moving through the process, but it really got highlighted there the last week of session and ended up passing. And this could be considered part of that Live Healthy package as well. But this really looks at consumer protection and transparency. It's going to rely or require hospitals to provide a consumer-friendly list of standard charges for healthcare services to be provided, as well as estimated costs. And those have to be provided to patients in advance of care being rendered. And also it requires insurance companies then to provide an advanced explanation of benefits to patients, to tell them what that means once you run those charges through their coverage, what they're actually going to have as far as out-of-pocket costs. And then on the back end, it limits some of the hospital's debt collection actions, and reporting practices for hospitals if you do have a patient that is past due on debts, for care that was received at a hospital level. So all of that transparency and consumer protection is wound up in that bill as well. And again, I think as the physician community goes, the more tools we can give to patients to understand their out-of-pocket costs, to be able to budget and anticipate what they're going to need to secure care, is a good thing. So hopefully this can drive a little bit more awareness and transparency for patients as well.
Yeah, and that transparency is key. Obviously, on the physician side, we're deep in the weeds, but sometimes those the patients come to the table, and this will help them kind of clear up some of those questions before they even get asked. So that's moving in the right direction there, and we'll move on as well to the third topic this week. Final score shows legislature passed 16% of bills filed this legislative session. What healthcare issues were left on the sideline?
Yeah, so I put a little sports analogy in there as well, just because we're looking at the scoreboard, and how the legislature did. This is a similar count, percentage of bills passed that we normally see. I know a lot of our physicians always kind of wonder how much work gets left on the table or not, but you had, what, 2,000 bills that were filed this year, and I think the final count is 324 passed both chambers. For a process standpoint, all those bills that were filed, they don't continue on to next year. They start from ground zero next year. So they begin from the very beginning if these are issues that people want to continue to pursue in future legislative sessions. But a few big issues that were on the table for healthcare that ended up not moving through the process. The first one is the wrongful death expansion, that we had some concerns with, expanding the rights of adults to sue for wrongful death here in the state of Florida. That one ultimately did not get passed. If you'll recall, back in session, the Senate had put med mal caps on their version of the bill. I think that helped ultimately lead to it not moving very much further through the process. So we'll see if that emerges next year. Most likely it will. That's been filed 3 or 4 years in a row. So it's almost a 99% chance that bill is going to be on the agenda next year. Sovereign immunity increases for state institutions as well. That was a bill. Again, it's near and dear to the heart of a number of the public hospitals in the state. They were looking at increasing sovereign immunity limits just a little bit. I think going from 200,000 to 300,000. So a small incremental increase in the immunity limits, but that bill ultimately failed as well. So that most likely will be back on the table next year. And then a couple of scope of practice type issues. First of all, it actually became termed the eyeball wars again later in session, but it's the healthcare practitioner titles bill that passed last year and went all the way through and got vetoed by the governor. That bill was still being debated up to the last day of session, but in the end, the House put on an amendment that the Senate couldn't live with. So that healthcare practitioner titles bill failed. Again, that's the one that we support as organized medicine, just trying to provide patients more transparency in the training of those practitioners that are treating them, primarily in institutions. And then I did want to mention there was quite a few scope of practice bills that were filed. Most of them died early in session, never got much momentum, but all of those scope bills seemingly died this session. So we should not see any major expansion in scope of practice coming out of this legislature either. So those were kind of the major things that were left on the table. There's obviously hundreds of other bills, but those were ones that were kind of more important to organized medicine that I want to mention here in this kind of wrap up session that we've got.
Well, yeah, and we kind of broke that down week by week as things were kind of falling off the table, and some of our guests kind of pointed out that some of these topics are for the long run and will come right back to the table next year. But as far as session, it is all kind of wrapping up now. What are we going to do here, Fraser? What happens with our weekly updates going forward?
Yeah, so there's not much drama. I was telling you earlier, it's like going to the Arnold Palmer Invitational yesterday with Scheffler in the lead. He kind of dominated the field, and there was very little drama yesterday, and there was very little drama at the end of last week too. I think the legislature did a great job getting their priorities done early in session. getting a budget agreed to and passed in enough time with that cooling down period that they were able to leave town in time. So there's very little drama, which is good, and probably the legislative leadership deserves some credit for shadowing through, a really successful and on time session this year. As far as where we go from here, as we kind of teased a couple weeks ago, I think we're going to turn our focus to the primary elections in August and the general elections in November, and start to invite some guests to join us to talk about their campaigns, and obviously talking about legislators that are running for a re-election or running for office the first time. I think we could use this venue to provide a platform to introduce our members to some of those candidates that are running for office, or those existing leaders that are trying to return to Tallahassee, and talk about some of their accomplishments, some of the healthcare projects they have in mind, and give an opportunity again for our members to get to know these leaders in the state. So I think that's going to be our focus, Joe, moving forward.
That sounds fun. Obviously, when we had the guests on during our weekly recaps, it added another element, and this is a whole new element. I think obviously, it feels like it's a long way away, the election, but a lot happens between now and then. So we'll bring on some guests and let people know what's going on as we get closer and closer to that election.
Yeah, and it should be fun. It won't be as much nuts and bolts as this legislative session updates goes. I know a lot of this is very, focused on legislative language and statutory stuff. I think we'll have a little bit more fun with this, where we'll just get to know people in a casual environment, and I think it'll be a good way to develop those relationships.
Yeah, sounds good to me. Well, Fraser, every week it's been a real fun time just getting together and kind of going everything that's been going on over there in Tallahassee. We'll continue, like you said, bringing on some special guests. But for now, thank you very much for joining me each week, and I look forward to whatever comes in the future.
Absolutely. Thanks, Joe. Appreciate the partnership, and here's to a successful legislative session.